Welcome, everyone. I would like to call this Committee of the Whole meeting on April 2nd, Tuesday at 4:00 PM to order. May we have roll call, please?
Benachak,
Present.
Radke,
Move to excuse.
All in favor?
Aye.
Opposed? See none? Motion carries.
Nemec,
Here.
Millet,
Here.
Garrett,
Move to excuse.
Support.
All in favor?
Aye.
Opposed? See none? Motion carries.
Poyer,
Present.
Baggett.
Here.
Okay, would everyone rise and join us in Pledge of Allegiance? I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Is there any changes to the agenda?
I'll move the agenda. Support.
All in favor?
Aye.
Opposed? See none? Motion carries. The minutes of the 3/5/24.
I think we have to do approval of agenda.
Well, he pretty much already said it when he had
You did
changes.
changes, yeah, okay.
What'd you do?
He went ahead.
I'll move it.
Support.
Any questions? All in favor?
Aye.
Opposed? See none? Motion carries. At this time, this is for public input. Is there anyone that wants to address the committee? Please come forward. Going once. Going twice. Public input's closed. Petitions and communications. The Department of Criminal Defense, MIDC grant renewal for the 2024 and 2025 year.
Motion to approve. Support.
Any discussion? Yes, Lon.
Since we have our counsel here, maybe we have her say a few words, and she has someone with her. And, yeah.
Good afternoon, everybody. I'm Andrea Levine, the Director of Office of Criminal Defense. I prepare the grant application every year in compliance with the Michigan Indigent Defense Commission. And it mandated probably about 5 years ago that we have to meet certain standards. And we've been really excelling at that, and I think we're doing a great job. So I'm happy to answer any questions.
So the state's been funding it, you would say adequately to do your job? They've been living up to their...
Yes, the amount that the county pays has stayed pretty consistent. It's statutory, and any amount we need in excess of that to meet compliance standards, we request and with supporting documentation, and they have given it to us. Every time I've asked for more, and they have given it to us every single time. When we started, I believe it was calculated that our county spent about $600,000 on indigent defense. So that's what and these are just approximate numbers, but that's what we're required to pay. Now our budget's just under $2 million. So all that additional funding and jobs that we've had have come from this grant. And they've been, I think our quality of defense has improved significantly because of this.
Statutory funding is good. We're trying to get that for revenue sharing also.
I bet. They've been wonderful to work with. Finance, they've been great to work with too, and it's really helped, I think, our defense a lot.
Thank you.
Thank you. Is there anyone else?
No.
Thank you.
Thanks.
All in favor?
Aye.
Opposed? Seeing none, motion carries. Community Corrections Manager, MDOC grant funds for the 2025 year.
I'll move it.
Any discussion? Yes, Vaughn?
Is anybody here? So in here, there's money for substance abuse training or, for prisoners or to keep them out in the community so they don't have to be in jail. So we're looking at this opioid money we have, so I think we need to have a conversation about some of this grant money that they get and see if we can use some of our opioid money maybe to augment this if they need more money, or, you know, do you have any?
Yeah, we can talk to the sheriff, because I do know that they administer medications to the inmates to help control their symptoms of withdrawal, and I believe that medication continues after they're released, but that would be a good appropriate use to some of that opioid money.
Meeting next week about it, and Bridge Magazine, I don't know who gets Bridge Magazine, it's from Lansing, and they talked yesterday about the opioid money sort of gathering dust a little bit, pushing us to get it out, but, you know, but doing it diligently or prudently to the right place. So we are meeting about it next week.
Yes, and especially the state, the amount of money that they've gotten to
Yeah.
their.
That's why I'm concerned about
Not
the
moving
state
too quickly.
got all this money, and what are they going to do with it, and are we going to do the same thing they're going to do? And so there's a lot of questions we have about what to do with the money. So, thank you.
Thank you. Thank you, Joe.
Thanks.
All in favor?
Aye.
Opposed, seeing none, motion carries. 2025 service provider contracts, agreements, and MOU.
Motion approved.
Support.
Any discussion? All in favor? Aye. Opposed, seeing none, motion carries. The Environmental Affairs and Community Development Department, Transportation Planning, BCATS Director, Memorandum of Understanding with MDOT for 4-year 2025.
I'll move it.
Support. Any discussion? Yes.
Are
We
you
have-
here?
Have somebody here maybe that would like to
Yes.
speak about that.
Hi, Laura Ogar, Director of Environmental Affairs and Community Development. I just wanted to take a moment to introduce our Transportation Planning Director, as he has not attended one of these meetings previously, or at least presented. He is formerly from the Midland Transportation Planning Department, and he was prior to that working with some tribal issues, so he's very good with negotiating these types of agreements. But also Brian Gillette not just knows transportation planning, he had been working specifically in that program for 7 years. He knew all of our key players that we also interact with at DOT, the folks in Lansing, some of our regulatory people, and so I'm just very pleased. We've had a lot of short staff in our department, and Brian has been more than seamless. He's picked it up, and I wanted to take this moment to introduce Brian Gillette.
Obviously, I'm glad to answer any questions. The subject at hand today is a MOU that really is a document that MDOT really hands to the MPOs, and it's an MOU between BCATS, Michigan Department of Transportation, and Bay Metro Transportation Authority. And it basically, all it does is it accommodates some federal regulations that essentially say we all have to work together. That's the quickest way to summarize the MOU. We all have to work together. We all have to agree on what it is we're going to be doing. And it's supposed to be an annual thing. As a practical matter, it's probably not going to be. The last one was before you in 2021. Prior to that, it was 2018. So it's just whenever MDOT basically says, oh, we should do those over again. They don't even change a word of the substance, but basically we have to get it authorized by all parties concerned, and that starts here.
Okay.
So.
Thank you,
Yes.
Brian.
So my people along 3 Mile Road want to know, why couldn't they do the bridge and the road at the same time? Because they did the bridge over US 10 on 3 Mile last year. That's an MDOT project probably. And then 3 Mile is a local project, but, you know, memorandum of understanding, we could maybe coordinate. I probably don't have a good answer for that. Yeah.
I actually don't, other than what you just said, which is, one part of that is obviously a Bay County Road Commission project, and the other is an MDOT project. And I do know that through our committee structure, our technical committee and our policy committee, which meets every month, there's an awful lot of discussion and coordination. So to the extent that it's possible, I'm pretty sure that that did get coordinated, if you will.
Yeah. Thank you.
Thank you. Anyone else? Thank you, Brian.
Thank you.
All in favor? Aye. Opposed, seeing none, motion carries. The Department of Aging, premium pay for direct care workers, funding for the 2024 year.
I move it.
Support. Any discussion? All in favor?
Aye.
Opposed, seeing none, motion carries. 2024 Senior Project, Fresh Market Fresh Program.
Motion approved.
Support.
Any discussion? All in favor?
Aye.
Aye.
Opposed, seeing none, motion carries. The Director of Administrative Services and Veteran Affairs, Bay City Chapter 513 of the Military Order of the Purple Heart Convention.
I'll move that.
Support.
Any discussion? Yes, Vaughn?
As Matt mentioned, we have funding in our budget for I think at least one of these a year conventions, and it brings people into Bay County. So that's a good thing. Thank you.
Thank you. All in favor?
Aye.
Opposed, seeing none, motion carries. Recreations and Facilities Director, Golf Course Fee Schedule Revisions for the Youth on Course Program, YOC.
I move it.
Any discussion? All in favor?
Aye.
Opposed, seeing none, motion carries. Finance Officer, the analysis of the general fund equity, 2024.
Motion received.
Support.
Any discussion? All in favor?
Aye.
Opposed, seeing none, motion carries. The update regarding Executive Directive 2007-11.
I move to receive.
Support. Any discussion? All in favor?
Aye.
Opposed, seeing none, motion carries. ISD, People-Driven Self-Service Password Reset Budget Adjustment Statement of Work.
I'll move it.
Support.
Is there any discussion?
I think we have an ISD person here.
Yes.
Back there.
Looks like a long term. I'm sure you can explain it.
Sure. So we receive hundreds of calls a year of people wanting to reset their passwords. And one of the things, like many other sites, you can do a self-service password reset. So that's something that we would like to implement. So a user would essentially sign up for it for themselves, and they would have a series of questions they would answer just as you would on similar sites, and they'd be able to reset their passwords themselves. So what we're having to do is when someone calls after hours on call, we are paying employees essentially to reset passwords. So this is a way to empower users and then also streamline the number of calls we get after hours.
Plus, I like the duo, your duo sign-on thing.
Yeah, that's the multi-factor authentication.
That's the quickest response that I get for, you have to wait for something to come up on your
Yeah, absolutely. It's a great application. So what happens is it just interfaces with the Duo. Duo says, yes, you work, authenticates with Bay County. It's really almost instantaneous.
phone. Quick, thank you.
Okay, thank you.
Thank you, Julie. All in favor?
Aye.
Opposed, seeing none, motion carries. Purchasing bid award for the Bay County Health Department, electronic health record software to Patagonia Health.
I'll move it.
Support.
Or is there any discussion? Yes, Vaughn?
We have Joel here. Everybody comes to the meetings, we should have them speak, right?
Yes, yes.
This question, what will this help you do, I guess? Medical records?
So this is going to replace our current electronic medical record system. And if you recall, during COVID, when, we had to do the mass vaccination clinics, the current electronic medical record system fell far short of our expectations. So this particular software, Patagonia, is really geared towards public health departments, especially those working in a clinical setting. It's got a variety of different interfaces and utilities that can be used, and we can actually bring more services out to people, even virtually. So it's a much better value than what the system that we currently have is, and it's used extensively throughout the state as well.
Are they ever going to get them to interact with each other? Because, there's Epic with Covenant, and Ascension's got another one, and Mid-Michigan's got another one. And I don't know
Yeah.
about the interface between all of them yet.
So one of the key aspects of this is that there are a couple of interfaces with the state of Michigan that it actually incorporates into its thing. One is for immunizations and uploading of vital information and communicable disease information. Another aspect, and it escapes me right now, the actual name of it, but so when we've got clients that if they're reporting to a hospital or a doctor's office, as long as that hospital and the doctor's office is participating, it's called MIHIN, Michigan, I think, Health Information Network, that it will actually interface with those services as well.
If nobody else has a question, I have one more about measles. My friend of mine wants to know, he's 85, and I said...
He's okay.
If
If you were born before...
You had measles or you got the shots for measles?
So that's a good question. If you were born prior to 1957, you have enough natural immunity. I would say this, though, that he probably should consult his provider, his physician, because there might be some people that are medically at risk or that they're more susceptible. So they might want to give them a booster shot. But most people born prior to 1957 don't have to worry about the vaccination. Most people, and I will say this, even through this current year, at least 80 to 90% of people born after 1957 have received at least one dose of the measles. I mean, now it's measles, mumps, and rubella shot.
Thank you.
Jim, you got a question?
I want to compliment you, Joel, on securing this new software. It will make the activities of our Bay County Health Department more transparent to the public. And I know that we've met with individuals who had some concerns because they're immunocompromised about certain restaurants and their practices and being able to view the latest data on restaurants. Could you speak to that?
Sure. So that's part of environmental health software, which is different. But we currently, about 10 years ago, we had a software called Health Space, and it was originally purchased and it intended to categorize and upload all of our well and septic information, as well as be a restaurant inspection software. As far as a restaurant inspection software, did a really good job, and we were able actually to offer, just as kind of a courtesy to people, an opportunity for them to view inspection records at no expense over the internet. As far as a well and septic inspection and repository for information, it was terrible. So we moved on from that software, and now we've gone to the Fetch GIS system, where we have been able to categorize and upload information well over, I think, 13,000 different parcels that you can actually get online for that. But the only thing it doesn't have is the ability for us to publish inspection reports. Now, you can still get inspection reports. We just ask that you fill out a Freedom of Information request form. And generally, it's not going to cost you anything. They're usually about 1 or 2 pages long. We want you to be specific, too. It's like you can ask for every restaurant inspection form, but that's going to take time to compile all of that data. We're still transparent. We're hoping that in the future that we'll be able to have that service, but Fetch is actually working with quite a number of different health departments now, bringing them on board with their well and septic inspections. But in addition to that, they've got a backlog of items that they are working on for us. So, we're in contact with them and have discussions about it, but there is a short staff a small staff at Fetch, and they've got an enormous amount of work to do. But I will say this, is that one of the things that we're actually proudest of, we were the first county in the state of Michigan to be able to upload all of the well and septic information and make that available to the public. And that's virtually not heard of at all in the state of Michigan and even in the United States. So we had a discussion, we want to be transparent, but the best analogy I can provide to that is my first car was a 1982 Plymouth Horizon TC3. It had a spoiler and a sunroof, and it was really cool looking, but it was a piece of junk. And I eventually had to trade that car in for a better running car, and that's what we had to do with the environmental health software, so.
Thanks, Joe.
Thank you.
Thank you.
Thank you, Joe. All in favor?
Aye.
Aye.
Opposed, seeing none, motion carries. The purchasing bid award for Bay County Community Center gym floor to Dynamic Sports Construction.
I'll move it.
Support.
Is there any discussion? Yes.
Kristen asked, so this floor is going to be a nice floor. The old floor is about 50 years old, or?
At least. The current floor is a tile floor that is crumbling. We can't get replacement tiles that are the same thickness. We believe it to be original to the building, and it's past due time for replacement. So this actually was approved in the 2023 budget, and it's kind of a holdover from last year since we didn't get the bid out till far into December. And the floor that we'll be installing is a multi-use floor, so you'll be able to play basketball and volleyball and pickleball on it, but you'll also be able to put tables and chairs in it for different events or art fairs or whatever. So it's sort of it allows us to use that room for any event. Where like a wood floor, you don't typically put tables and chairs on and things of that nature. So we're looking forward to getting it done.
Thank you.
I remember playing on it in the 1970s, so it's pushing 50, I
Yeah.
would say.
I believe it.
Yep.
Thank you. Anyone else? All in favor?
Aye.
Opposed, seeing none, motion carries. The payables, the general, everybody's got those. Any referrals? We need moving. Is there a motion for the payables?
I'll move it.
Support.
All in favor?
Aye.
Aye.
Opposed, seeing none, motion carries. Any referrals? Any unfinished business? Any new business? Amber, is there a need for closed session? Miscellaneous. Announcements.
Motion adjourned.
Support.
All in favor?
Aye.
Meeting adjourned.